Hello, I am here with a very pertinent topic, a topic which is pertinent to the modern age. Every day we listen to people saying that I feel depressed. I've been depressed for last 1 week. What we call depression normally, does it amount to an illness is what we should look into, and why we should look into treating and recognizing depression in people around us is because it adds to a lot of suicides, and suicidal tendencies is something very fearsome. So we must recognize and treat and address depression in people who are around us. So depression, there were a lot of theories like it is the after effect of a sin, or it is just people being irresponsible and they're just procrastinating. Those kind of interpretations were made regarding depression, but we know that depression is beyond that. There is a biopsychosocial model of depression which is now backed by scientific evidence. Biological factors are, one is a genetic factor. People who have history of any neurological or psychological illness in the family are more prone for depressive illness or for any psychiatric illness for that matter. So genetics does play a role. Apart from that, the chemical imbalance. We know that there are some neurochemicals or chemicals, those are secreted in the brain, which are named as noradrenaline, serotonin, dopamine, etc. Nowadays we've been talking about dopamine extra and low dopamine and etc. So these neurochemicals play a very vital role in causation of depression, and the low levels of most of these neurochemicals result in depression. These are a few biological factors, those are implicated in depression, depressive illness. Then there is a psychological model which speaks about childhood trauma, unpleasant experiences in childhood, physical or emotional neglect that happens to a child during his early growing up years. Now coming to the social factors. Social factors, we have the Harvard Human Development Study which is happening since 1938. It has been following a few Harvard students whom we know to be the best academically and intellectually, and they have been followed across their lifespan. And beyond the success, the professional success, beyond the financial capabilities that they gained, the increased lifespan was shown to be directly correlating with interpersonal relationships. And of course, addictions and suicidal tendencies also were less in people who had good interpersonal relationships ever after their teenage. So this is a very landmark study which throws some light on the importance of interpersonal relationships beyond success, beyond the money you make, and beyond the academic endeavors that you undertake. Now, talking about a few other social factors, during the COVID pandemic times, we really experienced what is known as social isolation, and the digital revolution added to social isolation. We were all, individuals are converted into one unit, and they were, one individual was one unit, which is a mobile phone or a laptop, and the social interactions were very minimal, especially during the pandemic. And this pandemic time saw increase of depression by 25% in the society in general. So this is regarding the social model. So this is the biopsychosocial model of depression, which is backed by scientific evidence and data. Now, when do you diagnose depression? It is very important that we recognize the signs of depression. One is melancholy or unhappiness that is spread across the day. Second is anhedonia, that is lack of interest in doing even things that you liked. Like if you were fond of singing or reading or playing, you no longer enjoy those things. So that is lack of interest in things that you used to enjoy. Then fatigue, unexplained fatigue. Many times people come with fatigue and we are not able to find out a reason for their fatigue. And sometimes they come with the physical symptoms like generalized numbness, headaches, unexplained body aches, etc. Then poor sleep, especially early morning awakening. You may easily go off to sleep, but you may be awakened quite early in the morning, leaving you fatigued during the day. Then there is poor appetite, then there is lack of concentration. As you are trying to focus on a particular thing, a sea of thoughts rushes into your mind and then it distracts you from what you are trying to do. Slowing down of actions. Generally, slowing down of thought process and actions is something that is again one of the signs of depression. Depressive thoughts which may not be in concurrence with reality, like which may be in contrary to reality. People just keep feeling that they are useless, they cannot do anything, they are utter failures. All these unhappy thoughts which are not in concurrence with reality. Then there are most important of all, suicidal thoughts. If these, any of 5 out of 9 symptoms that I just told you are present for more than 2 weeks, well, we must think in terms of depressive illness. And if there are suicidal thoughts, the cutoff of 2 weeks may not be necessary to diagnose depression, because it's a very, very, very important sign which should not be missed and which should be very readily paid attention to. If we talk about teenage depression, which is rather common now or commonly diagnosed now, the symptoms may vary a bit than what I told you regarding the adult depression. There may be anger instead of lethargy, instead of slowing down, there may be anger and agitation. There may be increased sleep instead of reduced sleep. There may be a lot of hunger, the hunger which cannot be quenched by anything, and the children might get up in the night and try to eat everything they come across. And then there is restlessness, inability to sit idle. All these symptoms may be signs of teenage depression. So if these signs are present for a period of more than 2 weeks, then well, we must think of a depressive illness and we have to address these issues, especially in order to prevent attempts to suicide or suicidal thoughts. So let us look at a terminology that is known as mental health first aid. We always talk about physical first aid. When somebody gets injured, there is a burns, we know what to do. But what is this mental health first aid? It is the attention that one gives to sufferer who is around you. If someone who is known to you, your colleague, your friend, your family member, appears to have these signs, then well, you must pay attention to it and you must try to talk to the person without being judgmental and being empathetic. We have to be a good listener first of all. We may not be able to suggest solutions in each and every situation, but being a good listener also helps. It helps a lot. Let us not trivialize the problems, let us not try to make fun, and most of all, we must keep the facts that is he or she has shared with you a secret. We must maintain confidentiality in the conversation we had. So, listening to someone with empathy, listening to someone without prejudice is very, very important. That is the most important part of mental health first aid. And whenever possible, wherever possible, we must give them support and help and direct them to a proper clinician or a person who can treat depression. Now coming to treatment, it has to be drug treatment plus psychological interventions like cognitive therapy. It may not be psychological interventions alone. Just like in society we know that not only the psychiatric illnesses are stigmatized, but people are very reluctant to take drug treatment. They think that it will go on and on and on, and they'll be branded as insane forever. They would not be able to function normally, which is not true. If we look at the celebrity list who have had depressive illnesses in their life, we'll be really shocked and we'll be amazed at the way they got treated for the disease and they moved on. They held very important positions and carried out their responsibilities perfectly after taking treatment. So one should never be reluctant to take drug treatment, because when it comes to altering the chemical levels or neurotransmitter levels or neurochemical levels in one's brain, definitely drugs have to play a role. And the treatment may last from 9 months to 1 year or even longer, according to the psychiatrist who's treating you decides. Definitely one must leave the treatment decisions to the doctor who's treating you. Plus you must undertake a psychological intervention in the form of cognitive therapy, which has to be done very systematically. So the treatment has to be just like for a physical ailment. You get a fever, you treat, you go to a physician, get treated. If you have a fracture, you go and get treated by an orthopedician. The orthopedician asks you to put the plaster or cast for 3 months. You do that precisely, then gradually you undertake physiotherapy and get your limb back to work. So this is exactly how a psychiatric treatment also should be done. It should be done for a proper period, and it should be always complemented by cognitive therapy or psychological interventions. So let us look at depression more comprehensively. Just like a physical ailment, try to detect or recognize the signs of depression in people around you, and let us always try to provide some psychological or mental health first aid to the sufferers around us. Thank you.